To another CTV News exclusive, one of the most controversial practices in our healthcare system has escalated considerably. We're talking about temporary workers like nurses hired from private agencies. As our Penny Daflos reports, the cost to taxpayers is exploding, a problem the health minister is trying to downplay.
Frontline staff in many BC hospitals aren't the unionized public workers we expect to care for us, but short-term contractors hired from for-profit staffing agencies. For the past 2 years, CTV News has been exposing the soaring costs of essentially paying a middleman to provide staff to the public system, many of whom have been poached from health authorities. We now know the costs have escalated dramatically. From 2018 to partway through 2022, the total was roughly $164 million. But the costs have multiplied, a whopping $162 million for the last fiscal year alone.
It'd be nice to make declarations that we're going to end agency nursing, but we have to maintain it as we build out and have all of the recruitment efforts we're doing in those communities as well.
The health minister agreed to an interview before his staff provided those totals. In the past, the pandemic and the healthcare system's need for contact tracing and vaccinations were touted as the causes, but it's now become the norm. When CTV News obtained the contracts after a Freedom of Information battle, we found nurses can make an extra 30% wage to do the same job through a staffing agency.
I would call it a parasitic industry because they are really benefiting from the severe shortages we're seeing in our public healthcare system.
We've got to keep particularly emergency rooms open, so we are doing more agency nurses.
The minister insists they're trying to rein in spending on those contracted nurses by making union jobs more attractive and cracking down on the staffing agencies.
We have frozen the contracts involved, and the provisions of those contracts which are being renewed as we speak ensure that people who are working in the health authorities can't do both, which is important. So we're making important changes.
And Penny joins us. So Penny, this is costing taxpayers a lot of money. So why was this information so hard to obtain?
I wish I had the answer to that, Mijung. I have been asking for it since September and kept getting the runaround. Clearly, they knew the numbers would not look good, and it appears that the predictions were correct. It is difficult, maybe impossible, to reverse this trend. If nurses can make more money doing the same job, some of them will forego a pension in order to have cash in hand right now, as well as better working conditions, Mijung.
Okay, thank you, Penny.